So if you were a woman, your biological clock actually started ticking before you were even born.
Which is pretty wild to think about.
Right. And according to the data we're looking at today, whether or not your mother smoked during her pregnancy, that might be the exact reason your joints ache or your sleep is broken or, your brain feels incredibly foggy right now at age 42.
Yeah, we tend to think of reproductive aging as this sudden switch that just flips at 50, but the science tells a completely different, multi-decade story.
It really does. And the cultural narrative is, frankly, it's incredibly binary. And it does a massive disservice to anyone trying to understand their own body.
Exactly. I mean, we are conditioned to believe you are either in your reproductive years or you're in menopause. And we completely ignore this massive, chaotic transition period right in between.
Which is exactly what we are unpacking in this deep dive today. Our mission is to answer a surprisingly complex question, which is, what is the average age to start experiencing menopause symptoms?
And it is definitely not as straightforward as people think.
No, definitely not. We've pulled together this whole stack of sources to figure this out, including the UK's National Institute for Health and Care Excellence, or NICE guidelines.
Which are crucial.
Yeah, and the British Menopause Society standards, World Health Organization data, and some absolutely mind-blowing longitudinal cohort studies. We are going to completely bust the myth of the magic number.
Yes, let's do that, because to even begin answering that core question of when symptoms start, we really have to throw out the way people casually use the word menopause.
Right, because there's the strict medical definition, and then there's the actual lived experience.
Yeah, they're two wildly different things.
So let's define those terms right up front, because going through these sources, I realized I was completely conflating them.
Most people do.
Right. So the data shows that the average age of menopause is 51 in the UK and about 52 in the US. But medically speaking, the sources point out that menopause isn't like an era of your life.
No, it's literally a single day on the calendar.
Which is crazy to think about.
It is. It marks exactly 12 consecutive months without a menstrual period. That's it. It's just a retrospective diagnosis. You only know you hit menopause a full year after the fact.
But the symptoms, right? The hot flushes, the mood changes, they don't just suddenly appear on that one specific Tuesday when you turn 51.
Right. No, they don't.
So, okay, let's unpack this. If menopause is just a retrospective milestone, what do we actually call the phase where the symptoms happen?
So that phase is called perimenopause, or the menopause transition. And the medical literature shows this phase begins 4 to 10 years before that final menstrual period.
Wait, 4 to 10 years?
Yeah.
So if the average age of that final period is 51, the average age you start experiencing the symptoms of perimenopause is actually in your early to mid-40s.
Exactly. And sometimes even late 30s, depending on the individual.
Wow.
What's fascinating here is the underlying biological mechanism driving this early onset. It's all mapped out in the STRAW plus 10 framework.
Which stands for the Stages of Reproductive Aging Workshop.
Yeah, right, exactly. It's essentially the gold standard model for characterizing how a woman's body ages reproductively.
Going into this, the best analogy I could think of for reproductive aging was a dimmer switch. Like, you hit your 40s, and your hormones slowly, gently turn down until the lights go out.
Which sounds nice in theory.
Right. But looking at the STRAW plus 10 framework, a dimmer switch feels totally wrong. A dimmer is smooth and linear.
Yeah, a dimmer switch implies this really predictable fading away. The reality of perimenopause is chaotic.
So what's a better way to think about it?
A much more accurate analogy would be a car running out of gas.
Oh, I like that.
Right, because it doesn't just smoothly glide to a halt. The engine sputters, it revs wildly, it stalls out, it jerks forward, and then finally it stops.
That's a great visual. So what is actually sputtering in the body during your early 40s?
Well, it's the ovaries. A woman is born with a finite number of oocytes, or eggs, and as you enter your 40s, that ovarian reserve becomes heavily depleted. And because the ovaries are running low on supply, the communication loop between the brain and the reproductive system starts to break down.
And the sources call this the hypothalamic pituitary ovarian axis.
Exactly, the HPO axis.
So the brain is basically trying to talk to the ovaries, but the ovaries are kind of losing reception.
That's a great way to put it. The brain, specifically the pituitary gland, has to shout louder to get the ovaries to do their job.
And how does it shout?
It does this by pumping out massive amounts of a chemical called follicle-stimulating hormone, or FSH. Think of FSH as the brain just slamming its foot on the gas pedal.
Oh, wow.
Yeah, and this forces the few remaining follicles in the ovaries to behave completely erratically.
So instead of estrogen and progesterone gently fading out like that dimmer switch, they're just jerking all over the place.
Exactly. You might have massive surging spikes of estrogen one month and then severe crashing drops the very next month.
Wow.
And that chaotic, sputtering hormonal roller coaster, that is the actual trigger for perimenopausal symptoms. And that biological chaos is fully underway years before the periods actually stop.
So it's not the absence of hormones causing the initial symptoms, it's the turbulence.
Yes, the turbulence is key.
Which makes me wonder, I mean, if the average onset for that turbulence is the early 40s, what is happening to the women who hit this sputtering phase much earlier? Like, what pushes that timeline forward?
Well, the sources outline two specific categories here. There's early menopause, which is defined as occurring between the ages of 40 and 45.
And that affects about 5 to 10% of women.
Right. And then there is premature ovarian insufficiency, or POI. That occurs before age 40 and affects roughly 1% of women.
Okay, so when researchers look at why that timeline shifts, what do they find?
Genetics and ethnicity are massive baseline factors. Like, a woman's age at menopause strongly correlates with her mother's age.
Makes sense.
And furthermore, cross-cultural data from the study of women's health across the nation shows that Black, Hispanic, and South Asian women tend to reach menopause earlier than white women.
And they often experience more severe symptoms for a longer duration, according to the data.
Exactly.
But, I always assumed your biological clock was basically just genetic inheritance, like you get the genes you get and you just have to deal with it.
A lot of people think that.
Here's where it gets really interesting, though. The research completely shatters the idea that it's only genetics. The data from the British birth cohort studies, specifically the 1958 National Child Development Study and the 1970 British cohort study, is just fascinating.
Oh, absolutely. Those specific British studies are absolute treasures in the medical community.
Because they prove your environment changes your timeline.
Right. They track tens of thousands of individuals from the exact week they were born in 1958 or 1970.
Just following them their whole lives.
Exactly. Gathering data on their health, their wealth, education, habits every few years for their entire lives. They reveal these lifelong cumulative patterns that short-term studies simply cannot catch.
And the findings they pull from that decades-long data are staggering. They found that non-genetic factors, things that happen to you before you could even form a single memory, literally alter your menopausal timeline.
It's incredible.
For instance, a woman had 30% higher odds of experiencing early menopause simply because she wasn't breastfed as an infant or was breastfed for less than a month.
Wow.
Even wilder, she had 24% higher odds of early menopause if her mother smoked during pregnancy. I mean, how does a mother smoking in 1970 cause her daughter's hormones to sputter at age 42 in 2012?
It comes down to how incredibly vulnerable the developing reproductive system really is. A female fetus develops all the eggs she will ever have while she is still gestating in her mother's womb.
Every single one.
Every single one. So environmental toxins passing through the placenta during that critical in utero period, they can permanently damage the initial quantity or the biological quality of that ovarian reserve.
So you are literally born with a smaller gas tank from day one.
You start life with a compromised reserve. And because that pool of eggs is smaller, or just less viable to begin with, it depletes much faster as you age.
Which triggers that chaotic perimenopausal phase much earlier.
Exactly.
And the hits to that reserve, they don't stop in infancy. The longitudinal data tracking the women's own habits is intense.
Oh, yeah.
Like, a 16-year-old who starts smoking has a 51% higher risk of early menopause compared to a non-smoker. The sources noted that women who smoke 14 or more cigarettes a day start the menopause transition almost 3 years earlier than the average.
That's a huge difference.
3 years of reproductive life just gone.
Well, the toxins in cigarette smoke actively accelerate the death of ovarian follicles.
Right.
And beyond smoking, the cohort studies highlight really deep socioeconomic factors, too. Well, women whose fathers worked manual jobs or who grew up in poorer circumstances were actually twice as likely to experience early menopause.
Twice as likely.
Yeah, this reflects that the downstream biological effects of chronic stress, poor childhood nutrition, and just lifelong environmental exposures.
The environmental piece is honestly scary. The sources mention these studies measuring bone lead levels, showing that women with high cumulative exposure to lead over their lifetimes reached menopause over a year earlier than those with low exposure.
Because lead is an endocrine disruptor.
Right, and it just sits in your bones, quietly accelerating your biological clock.
It really forces us to view reproductive aging not just as a genetic destiny, but as this cumulative ledger of every environmental exposure, stressor, and nutritional deficit a body has experienced since the womb.
It really makes you evaluate your own lifelong timeline.
It does.
But let's look at the actual experience of this. We know the timeline starts in the early to mid-40s. We know environmental hits can push that runway even earlier. But what actually happens when your body enters this sputtering perimenopause phase?
But that's the big question.
The medical sources constantly use the phrase vasomotor symptoms. But what does that actually translate to for a listener who is actively going through it?
So vasomotor refers to the constriction and dilation of your blood vessels.
Okay.
When your hormones fluctuate, your brain essentially gets confused about your body temperature. It suddenly thinks you are overheating and tries to aggressively cool you down by dilating blood vessels and triggering sweat.
And we colloquially call these hot flushes and night sweats.
Exactly. And they are incredibly common. They're experienced by 70 to 80% of women.
Irregular periods are obviously on the expected list too. But the sources outline this wild, frankly intimidating list of lesser-known symptoms that seem to have absolutely nothing to do with reproductive organs.
Oh, absolutely.
Like, we are talking about 40 to 60% of women reporting severe brain fog and memory issues, 70% experiencing musculoskeletal joint pain.
It's so widespread.
And then you see reports of tinnitus, burning mouth syndrome, newly developed severe anxiety, and heart palpitations. I mean, how is a fluctuating reproductive hormone causing ringing ears and aching knees?
If we connect this to the bigger picture, the fundamental flaw in our understanding is labeling estrogen strictly as a reproductive hormone.
Right, we assume its only job is to get the uterus ready for pregnancy.
Exactly.
Yeah.
But the biological reality is that estrogen is a master regulatory hormone, and there are estrogen receptors in almost every single tissue in the human body.
So when the ovaries start sputtering, the entire body feels the withdrawal.
Completely. Let's look at the brain, for example. Estrogen is a potent neurosteroid. It helps regulate glucose metabolism in the brain, essentially, how your brain cells get energy.
Okay.
When estrogen levels crash chaotically during perimenopause, your brain literally experiences a temporary energy crisis. That is the brain fog. It also regulates neurotransmitters like serotonin and dopamine, which is why women suddenly develop severe anxiety or mood swings just completely out of nowhere.
That makes so much sense.
Yeah.
And what about the joint pain?
Well, estrogen receptors are present in your cartilage and joints too, where the hormone helps reduce inflammation and maintain lubrication.
Oh, okay.
So when it fluctuates, inflammation spikes, leading to that 70% statistic of women experiencing sudden musculoskeletal pain.
And the same mechanism applies to your mucous membranes, right?
Yeah.
Leading to the dry eyes or burning mouth syndrome.
Exactly. And your cardiovascular system triggering those sudden heart
It
palpitations.
really is a full-body systemic transition. And reading the sources, it is so vital to understand that these aren't just brief inconveniences that last a few months.
Not at all.
On average, vasomotor and related symptoms last for 7.4 years.
Yeah, that's a long time.
Over 7 years of joint pain, brain fog, sudden anxiety, and sleep deprivation. That kind of chronic disruption heavily impacts a person's quality of life. The sources point out that an estimated 1 in 5 women take time off work due to these symptoms.
And a significant number leave employment entirely because they cannot get the medical support they need to function.
Which brings us to the most frustrating clinical hurdle, right? Identification.
Yeah.
Because the symptoms are so varied, mimicking arthritis, depression, or chronic fatigue, many women are aggressively misdiagnosed.
It happens all the time. A woman in her early 40s might be sent to a rheumatologist for joint pain or put on antidepressants by a psychiatrist for mood changes, with no one connecting the systemic dots back to perimenopause.
But hold on, if these symptoms mirror so many other conditions and it's happening in a woman's 40s when doctors might dismiss her as, quote-unquote, too young for menopause, how on earth is a GP supposed to know it's perimenopause? Is there a definitive test or are they just guessing?
So what does this all mean for diagnosis? This is where the guidance from NICE and the British Menopause Society is incredibly firm, yet routinely ignored by healthcare professionals.
Really? What do the guidelines say?
Their guidelines state that if a woman is over the age of 45 and presents with menopausal symptoms, the diagnosis must be based entirely on her clinical symptoms.
Meaning no blood tests.
None. The guidelines explicitly state that laboratory testing for hormones, like checking FSH or estradiol levels, should not be used to diagnose perimenopause in women over 45.
Wait, why not? I think most of us assume a blood test is like the ultimate objective proof of what's happening inside our bodies.
Sure, usually it is.
Right, if I want to know my cholesterol, I take a blood test. If I want to check my blood sugar, I take a blood test. Why wouldn't a doctor want blood work to prove my hormones are crashing?
Well, think back to the sputtering car engine analogy.
Okay.
Because estrogen and FSH levels are surging and crashing so wildly from day to day and even hour to hour during perimenopause, a single blood test is just a random snapshot in time.
Oh, I see.
It is clinically useless for diagnosis. You could draw blood on a Tuesday morning and the hormones might look completely normal,
Right.
but by Thursday afternoon, they're in menopausal ranges. Relying on a normal Tuesday blood test often gives a doctor false reassurance, which results in a woman being denied treatment for very real, debilitating symptoms.
So if a woman is 46, her periods are spacing out, and she is suddenly dealing with joint pain and night sweats, the doctor should just listen to her symptoms, recognize the pattern, and diagnose perimenopause on the spot.
Yes, absolutely. The clinical presentation is the proof. The only time blood tests are officially recommended is for women under the age of 45.
To catch the early menopause or premature ovarian insufficiency we talked about earlier.
Correct. In those younger age brackets, getting a clear diagnosis with the help of elevated FSH tests, usually taken twice, 4 to 6 weeks apart to account for fluctuations, that's critical.
Because the health stakes of losing estrogen in your 30s or early 40s are just incredibly high.
Very high.
So let's talk about those stakes. Beyond just validating that the brain fog and joint pain are real and providing some daily relief, why does identifying this perimenopausal onset matter so much for a woman's long-term future?
Because estrogen acts as a massive biological shield. When those levels permanently drop, a woman's risk profile for several serious chronic conditions fundamentally changes.
Give me an example.
For instance, estrogen is essential for bone remodeling. The loss of it rapidly accelerates bone density loss, dramatically increasing the risk of osteoporosis and severe fractures later in life.
It's like pulling the structural support out from under the skeleton.
Exactly. And it also alters the cardiovascular system. Estrogen helps keep blood vessels flexible and manages cholesterol levels.
So when it's gone,
Once it declines, women's historical advantage over men in terms of heart disease completely disappears. Their cardiovascular risk skyrockets, alongside increased risks for metabolic syndrome and type 2 diabetes.
wow. So recognizing that perimenopause starts in your early to mid-40s isn't just about managing today's discomfort. It is a critical window to protect your future self.
Yes.
It gives you a runway to advocate for treatments. The sources highlight hormone replacement therapy, HRT, as a recommended first-line treatment for managing symptoms and providing long-term bone protection.
Right, alongside non-hormonal alternatives and targeted lifestyle changes too.
Exactly. You have a chance to prioritize your cardiovascular and bone health before that estrogen shield is completely gone.
Because knowledge about the timeline empowers action. Understanding that reproductive aging is a systemic, decade-long transition allows women to make informed, proactive decisions about their health care.
Rather than just reacting when the damage is already done.
Exactly.
So let's summarize the journey we've taken through these sources. The prevailing myth tells us menopause is a light switch that flips on your 50th birthday.
Which we know isn't true.
Right, the biological reality. While the average age of your final period might be 51, the average age you start experiencing the sputtering, chaotic symptoms of perimenopause is in your early to mid-40s. It is a decade-long transition.
And it's highly individual.
Exactly. Your personal
Yeah.
timeline isn't just genetic. It's shaped by your socioeconomic status, your habits, and incredibly, the environmental exposures you faced in the womb.
Yeah.
And the symptoms aren't just a few hot flushes. They are systemic, impacting your brain, your heart, and your joints. Because estrogen is a master regulator for the whole body.
It really is.
And crucially, if you're over 45, you don't need a glitchy blood test to prove you were in perimenopause.
Yeah.
Your symptoms are the proof.
It is a profound, often overwhelming biological shift. But as we look at all this data, there is a broader context that completely changes how we should view this phase of life.
What's that?
Well, today, the global life expectancy for women is approaching 80 years.
Which means a woman will spend well over a third of her entire lifespan in a post-reproductive, post-menopausal state.
Right, 30 or 40 years without those reproductive hormones.
That's a huge portion of your life.
It is. And from a strict evolutionary biology perspective, that is absolute anomaly. Humans are one of the very few species on Earth, along with a handful of toothed whales, like orcas, that are biologically designed to outlive their reproductive capacity by decades.
Because most animals in the wild don't experience menopause, right? They remain reproductive until the end of their lifespans.
Exactly. Nature usually doesn't expend precious energy keeping an organism alive for decades if it can no longer pass on its genes.
Wow, so it presents this fascinating evolutionary mystery. Why did human societies evolve in a way that requires a massive, thriving population of postmenopausal women?
The evolutionary advantage must be immense. It suggests that surviving past reproduction isn't an accident or, a biological failure. It is a specific, highly selected evolutionary design.
That completely flips the script. It stops treating the end of your reproductive years like a biological decline and frames it as a graduation into a highly evolved, vital stage of life that the human species actually depends on.
It's a very empowering way to look at it.
It really is. Navigating that sputtering engine in your 40s isn't just about managing a loss. It's the intense, messy transition into a completely new, biologically purposeful era. Something for you to mull over as you advocate for yourself and navigate your own timeline. Until next time, keep diving deep.